Mr. Roger Wolfson, thank you so much for having us, myself, Luazi, here at your practice to basically find out a little bit more about the PMB and the book that you are going to be writing.
My name is Roger Wolfson. I'm a medical orthotist prosthetist by trade. And what I do is I make artificial limbs and I supply surgical appliances or orthotics in the hospital, in the private field. So if a doctor phones me up and says, we're doing surgery today, the patient will not be allowed off unless he's got a specialized knee brace to keep everything together so the patient can rehabilitate. Or the patient has fallen and hurt his back and he needs a custom-made brace, an off-the-shelf specialized brace. So that's what I do. Or they need stockings. I supply a service. I supply orthotics and prosthetics to the public, whether they're private sector or not, but a lot of the time it's private sector.
Okay. In layman's terms, what are prosthetics and what are orthotics?
Well, prosthetics is anything artificial. I make artificial limbs, like artificial legs, artificial arms, okay? And then orthotics are things that support the body. Either support the body after they've been injured.
Like a brace.
Like a brace, exactly.
Oh, fantastic. We're going to go a little bit into the purpose of why you wrote the book, but I want to know just a bit more about what is a PMB in the medical terms.
Okay, a PMB stands for prescribed minimum benefits. It's supposed to be something that the medical aids are going to use voluntary and happily to make sure that the patient gets his service without having to worry how he's going to get the money to pay for it, and the supplier that will provide it comfortably knowing that he's going to get paid from that particular medical aid. Because prescribed minimum benefit is a government law. There are 270 basic diseases that they cover, and they fall into three categories. One is chronic, one is emergency, and one is life-threatening.
Oh, so there's chronic, emergency, and life-threatening.
And everything basically ends up to life-threatening if it's not looked after.
Now, how does a PMB work?
So PMB is designed that if you're on a cheap medical economic plan, if you're on an economic plan or very expensive plan, your medical aid must cover it by law.
Covering it, you mean that it pays for a certain amount of the whatever?
It must pay for everything that you encounter. If you're diabetic, which is a thing, they must pay for your medicine, they must pay for your stockings, they must pay for everything involves diabetes. That's what the law says.
Okay. 16% of South Africans have got medical aid. From your experience, do you think most consumers are aware of that there's a PMB?
No, they're not. Even the guys lying in hospital that have already been PMB approved for the surgery have no idea that they are PMBs. You ask them, do you know what a PMB is? They say, no, I don't know what a PMB is.
Jeez. And then how does it impact them? How does it affect them? Not knowing that you've got a PMB, what are some of the worst case scenarios? What are some of the
whether they know that they are a PMB or not, the PMB is there to give the patient the comfort that whatever economical hardship they won't have an economic hardship. They won't have an economic trauma because the PMB has told the medical aid, you must pay, and it's a government law. It's got nothing to do with the medical aid per se. They must follow the law.
Wow. And statistics show that at least 58% of PMB claims become rejected because they state medical aid schemes state reasons like, not following protocol or patients did not fill in the forms properly. But most importantly, there's an area about codes that
yes. There is a thing called the ICD-10 code. ICD-10 code, very important. Now that code is the name of your sickness. It's a code next to your sickness. Whatever happens to you, it can be whether you got flu, could be whether whatever it is. There is an ICD-10 code, and some of those ICD-10 codes tells us that this is definitely a prescribed minimum benefit.
Wow.
For instance, if you have a sore back, and you go to the hospital and it says stenosis, meaning the spine is being clamped and you're starting to get pains in your leg, eventually you don't get feeling in your leg. That's a serious thing. That's a M48 something. That is the ICD-10 code.
Wow.
And they must pay for the brace. Whether you're on a hospital plan or whether you're on an executive plan, they must pay, and it should not come out of your savings.
And talking about out of savings, the new statistics say there's about 40 up to 40 billion rand is what South Africans have paid out of pocket towards PMB. What do you say about this? What do you think?
Well, the statistics talk for themselves. Obviously, the medical aids don't want to pay for PMBs. And the feeling I have, PMBs were gazetted in 1998. Round about 2006, 2008, it started filtering through. But before then, I phoned the medical aid and I said, why haven't you paid for this price? This is not part of his benefit. The patient must pay out of his own pocket. Then I found out afterwards that they should have paid, and they didn't. So can you imagine? It's pretty unfair.
It is. What are some of the worst case scenarios? Patients do not know this and they end up paying out of their own pocket.
Well, they end up taking out for expensive things like scans. They've got to pay a lot of money. They end up taking on extra loans. They end up going to loan sharks. They end up getting they get sick. And so the medical aid is to pay for the extra psychological trauma they're going through. They end up having a nervous breakdown, or the worst scenario, I've known people that are actually taking their own lives.
Are you serious? Because 58% of rejected PMB claims because of this ICD-10 code.
Now, let me put it to you this way. They don't deny. The medical aid doesn't deny it. They delay it to such an extent that the patient either gives up and the supply stops and starts demanding money, and then there's lawyers, and then there's blacklisting, and there's this thing because the guy needs to get paid. I mean, I supply a brace that costs me a certain amount of money. I have to cover it. I have to pay my staff. I have to do everything. Eventually, I'd have to sue the poor guy. But I don't want to do that because the government has put certain things in place that make sure that I'm going to get paid. And one of them is the prescribed minimum benefit law. And I hate asking patients to pay for something they shouldn't have to pay.
What's the best way to describe, how would you describe the PMB benefit as a tool?
Okay. It's just a tool. Unfortunately, you must treat it like a tool. I have a PMB condition. That's my tool. Now I need to know how to use it. Now if we take this drill for instance. This is a drill. It's going to make a hole in this piece of wood. I can't take my finger and dig a hole in this thing. I can't take my pen and make a hole. I need to know how to use this drill. So just like this, I need to drill a hole. See, I'm drilling a hole there. See, look. Luckily, I didn't drill it through my there. That. I need to know how to use this drill to make my hole. If I don't know how to use this drill, and I will never make this hole. I might not even know I need to buy a drill.
Oh, so that's what a PMB is.
A PMB basically is a tool that the service provider, the hospital, and the member can use to get their money. It's a tool. That's all it is at the moment. It shouldn't be, but it's a tool. And if you don't know how to use your tool, you'll never get paid.
Wow. And this is something that, how would you say is the general attitude of medical aid schemes towards PMB?
Well, just think about it. Think about the thing. If the medical aid had to honor PMBs, they had to honor PMBs, they'd have to pay out a lot of money. But if they thought through this and they used the PMB as a selling benefit, they could sell a lot more policies, a lot more I wouldn't say policy is not the word. They'd sell a lot more plans. They would sell a fortune more plans if the public knew, with the help of the government, they could get paid.
That's so true. It's actually a win-win. It could be a win-win.
It could be, but unfortunately at the moment it's not, because medical aids are not seeing it that way.
Who are the biggest losers here? I mean, 40 billion rand came out of pocket. Who would you say currently, lack of knowledge, who are the biggest losers?
Well, you get two major suppliers. And from my experience, unfortunately, it's a medical service provider himself who doesn't know the rules. He is a healer. He's not a business owner. He's a healer. He's there to heal people. I like to call my work mechanical healing. I heal people a mechanical way with a brace thing. It's part of my mechanical healing comes to the party. I'm a healer. I'm not an administrator.
Yeah.
I just want to send my account off to the medical aid, give the right codes and get paid. That's what I want to do.
Jeez, okay.
But now what I need to do, I've got this PMB law. I have to learn how to use the PMB law correctly. I have to educate my members, my clients, my patients lying in the government in the bed. He doesn't even know that he's a PMB. He's lying, he's having an operation. He's just terrified, what's this going to cost me? Because he knows the medical aid is going to pay for surgery. He's under the impression that if he's in hospital, I'll pay for the brace. No, they won't. They'll say it's not part of the benefits, out of hospital benefits or something crazy like that. They won't pay. Even though the patient won't be allowed off the operating theatre without that brace. He won't be allowed home without that brace. It's considered out of hospital. So, what does the patient need? The patient needs education.
Is this why you've written a book?
That's why I've written the book. My book is how to use the tool.
Oh.
If you don't know how to use your tool, you'll never make the whole, you see.
Because the biggest challenge is lack of knowledge.
So I've written this tool, written this book. I have scripts where the patient phones the medical aid. I have instructions for the patient to phone his service provider and get the correct medical aid number.
The code.
And I put the power into the patient's hand. If he's got a sore back and he's got stenosis and the surgeon's explained to him, he can look up his own medical aid. I teach the patient how to look up his own ICD number. He doesn't have to rely on the surgeon. If the surgeon says this code, he has the right to say, but doctor, this code is PMB and that code is... It's not medical science. He doesn't have to be a doctor to find out what code he is.
And then how soon would you encourage consumers to know what type of codes or just to know about the PMB in general?
First of all, it's very important that they know that there is a PMB rule and they need to understand the basic rules.
Oh.
But if his father or mother belongs to medical aid and they got diabetes, I know many scenarios where mommy fell and broke her arm. She goes to the general thing. The daughter or the son has to pay out of their noses to get surgery done because the plan doesn't cover this and doesn't cover that. In the meantime, it is a PMB. It falls under PMB.
Oh.
As long as they are a member. So these poor people, and then when you tell
the medical aid,
the client, listen, you shouldn't have had to pay, they get angry with me because they spoke to the medical aid. The medical aid said, no, it's not. But the medical aid's trained maybe to say, no, it's not a PMB. This guy doesn't know what he's talking about.
How does it impact your business, for example?
Well, it does, because it costs me a lot of money to collect my money. Something costs me a certain amount, I have to spend an extra 20% to employ people to go through this whole, to use their tools. I know the tools that cost me a lot less. But most guys refuse to actually, even though they know it's a PMB, They refuse to treat the patient. I've got a friend that had a broken back. She fell and fractured her back. She needed a spinal brace. The surgeon didn't want to operate. The physio didn't want to operate. She was on a Delta Core plan, which is a good plan. Covers a lot of stuff. But the surgeon didn't want to operate. Didn't think it was that necessary. But she had a fractured brace, and it was very necessary for her. So my colleague had an off-the-shelf brace, which in my opinion is not as good as a custom-made brace, lying in the back seat of his car. He's on his way to the hospital. He phoned the ward and said what medical aid it is. The medical aid said, she's on this plan. He said, can I speak to the patient? He said to the patient, do you have 8,000 or 10,000 rand to pay for this brace? The patient said no. Turned around in his car and went home. Because he knows he's not going to get paid.
Jeez.
But he hasn't read my book. Because I have two books. One for the member and one for the supplier. Obviously, they've got to handle things from two different. The medical aid has a special call center for the members, and they have a special call center for the suppliers.
So what is the DSP? What is a supplier?
Well, a supplier is a person that's registered with the Medical and Dental Council, and he's done a certain qualification, and he can supply the product. He can supply the product.
Oh, okay, I see. Oh, all right. And then they are obviously also directly impacted by, lack of, how can I put it? If there are problems within lack of payouts from PMBs or...
well, often the poor patient has to end up paying out of his own pocket. Because the doctor phoned me up and said, will you fit a pair of stockings? Will you fit a brace on this person? I know that is a PMB. I know that person should get paid by the medical aid. I know I should be paid by the medical aid, not the poor member.
And how might the book? How do you see the book helping customers?
Well, they will be educated. They will know how to use the PMB rule, which is a tool. They'll know how to drill the hole. Without drilling the hole, they don't know. They can't make a hole with their finger, you know.
Yes, absolutely.
So the book, I believe, is vitally important for the consumer to find out
how the PMB works.
How they're going to not be out of pocket. The supplier, when he gets his book, because he's got a different book, he'll know how to get his money out of the medical aid.
Consumers will
the hospital administrative clerk will know what to do, because we have streamlined things. We have special scripts. You phone the medical aid, you say exactly what I told them to say, without getting emotional, without getting upset. There are certain things that we can lock the medical aid into. If you lock that medical aid into agreeing, because I've got 40 years experience. I've authored for 40 years, but I've been in private practice since 1990. That's 38 years, am I right? No, 35 years. I've got many t-shirts, got many bloody noses. I've got many setbacks to learn. This is what needs to be done. And also, I'm going to use the member needs to be educated that the service provider and the member on the same side of the fence, they both want to get paid. The member needs to know that his brace, his prosthesis is going to get paid for by the medical aid, and the service provider needs to know that he's going to get paid by the medical aid.